Quiz CNA practice test. Question 1. A resident with Alzheimer's disease is wandering the halls. What should the CNA do? Lock the resident in their room. Tell the resident they are being naughty. Gently redirect the resident to a safe area or activity. Tie the resident to a chair. Redirection is a safe and effective technique for managing wandering behavior in dementia patients. Question 2. When should standard precautions be used? Only for residents with known infections. Only when the resident is coughing. For every resident at all times. Only when the nurse tells you to. Standard precautions are designed for use with all patients to reduce the risk of transmission of pathogens. Question 3. How often should a resident who is unable to move be repositioned? Every hour. Every 2 hours. Once per shift. Only when they complain of pain. To prevent pressure ulcers, immobile residents should be repositioned at least every 2 hours. Question 4. What is the primary goal of restorative care? To perform all tasks for the resident. To help the resident regain or maintain the highest level of function. To cure the resident's illness. To move the resident to a hospital. Restorative care focuses on helping residents maintain or regain their independence and physical function. Question 5. What should a CNA do before entering a resident's room? Walk right in. Knock and wait for permission to enter. Call out the resident's name from the hall. Check the resident's chart. Knocking is a matter of respect and privacy for the resident's home. Question 6. An ombudsman is someone who provides medical care to residents, advocates for the rights of residents in long-term care, manages the facility's budget, inspects the kitchen for safety. An ombudsman is an official advocate who helps resolve complaints and protect resident rights. Question 7. If a resident is in a vest restraint, how often must they be checked? Every 15 minutes. Every hour. Every 2 hours. Once per shift. Residents in restraints must be monitored at least every 15 minutes to ensure safety and circulation. Question 8. Which of the following should be reported to the nurse immediately during a bed bath? The resident is tired. A new red area on the resident's tailbone. The resident wants to wear a blue shirt. The resident is talkative. New skin breakdown or redness over a bony prominence is a sign of a potential pressure ulcer and must be reported immediately. Question 9. Which document describes the tasks a CNA is legally allowed to perform? The resident's care plan. The CNA's job application. The state's scope of practice. The facility's menu. The scope of practice defines the legal limits and responsibilities of the CNA role in that state. Question 10. What is a common sign of a urinary tract infection, UTI, in an elderly resident? Sudden confusion, increased appetite, better sleep, improved mobility. In the elderly, UTI is often present with cognitive changes or delirium rather than just physical symptoms. Question 11. A resident is having a seizure. What is the CNA's priority? Place a spoon in the resident's mouth. Hold the resident down to stop the shaking. Protect the resident from injury and clear the area. Run out of the room to find help. Safety is key. Protect the head and clear objects away. Never put anything in their mouth or restrain them. Question 12. When communicating with a hearing-impaired resident, the CNA should shout as loudly as possible, speak slowly and face the resident directly, only use written notes, avoid talking to them. Facing the resident allows them to see your lips and facial expressions, and speaking clearly helps communication. Question 13. What is the normal range for an adult's oral temperature? 96.6 to 98.6 F, 97.6 to 99.6 F, 98.6 to 100.6 F, 95.0 to 97.0 F. The average oral temperature is 98.6 degrees Fahrenheit, with a normal range typically between 97.6 degrees Fahrenheit and 99.6 degrees Fahrenheit. Question 14. Which pulse site is most commonly used for taking a routine pulse? Carotid, radial, brachial, apical. The radial pulse, at the wrist, is the most common site for measuring heart rate in adults. Question 15. A resident is nearing the end of life. What is the CNA's primary role? To encourage the resident to eat a large meal, to provide comfort and emotional support, to discuss medical treatments with the family, to ignore the resident since they are dying. Palliative care focuses on comfort, dignity, and support for both the resident and their family. Question 16. If a CNA sees another staff member hitting a resident, what is the first action to take? Call the police immediately, stop the abuse and ensure the resident is safe. Report it at the end of the shift. Ignore it if it doesn't happen again. Safety is the priority. The CNA must intervene to stop the abuse immediately. Question 17. What is the most effective way to prevent the spread of infection? Wearing gloves at all times, washing hands frequently, using antibacterial spray on everything, keeping all residents in their rooms. Hand washing is the single most important practice in preventing the spread of infection. Question 18. When a resident is on a bladder training program, the CNA should restrict the resident's fluid intake, take the resident to the bathroom on a scheduled basis, tell the resident to hold it as long as possible, always keep a catheter in place. Scheduled toileting helps the resident regain control and awareness of bladder function. Question 19. A resident is choking and cannot speak or breathe. What should the CNA do? Perform the Heimlich maneuver, abdominal thrusts. Offer the resident a glass of water. Wait for the nurse to arrive. Hit the resident on the back. Abdominal thrusts are the standard emergency procedure for a conscious person with a complete airway obstruction. Question 20. Which of the following is a sign of dehydration? Clear, pale yellow urine, moist skin, dark, concentrated urine, increased appetite. Dark, strong-smelling urine and low output are classic signs of dehydration.